This Saturday, the Centers for Disease Control today issued a health warning for Americans following a worldwide outbreak of a mysterious form of pneumonia, causing deaths and sending scores to the hospital. Tony GUIDA has the latest.
The mystery pneumonia has infected more than 400 people and killed 9, including an American businessman in Hong Kong. There are 4 known cases in Canada, including 2 deaths in Toronto.
The question is it influenza, or is it a new disease which we don't know, or is it a disease which we know, which has somehow mutated into a more virulent form?
Today, a surgeon is under quarantine in a German hospital. The doctor had treated a person with the disease in Singapore this week, then flew to New York for a medical conference. He began suffering symptoms of the illness before flying to Frankfurt last night on the way back to Asia. 155 others on the doctor's flight were also quarantined.
We have no reported cases in the United States. However, we've had travelers pass through the United States who may have been exposed.
Officials at the World Health Organization tell CBS News they are alarmed for 3 reasons. They can't identify the cause of the disease and thus can't treat it. It spreads easily person to person, and respiratory distress and failure occur early in those infected.
The point here is to not panic until we have a better idea what we're dealing with. All the health authorities are on extreme alert right now.
Health officials tell CBS News they're not even sure if the illness is viral or bacterial, but they lean toward viral, which is more difficult to treat. Doctors for the Centers for Disease Control and Prevention are in Hanoi gathering samples from people who may be infected. Those samples are being sent to the agency's labs in Atlanta for tests.
On this second day of a U.S. health alert, doctors in this country and others around the world are rushing to identify a deadly mystery illness in an effort to contain the outbreak. CBS's Gretchen Carlson has the latest.
German health officials said today the condition of a Singapore doctor believed to have been infected with the mysterious pneumonia-like illness has worsened. The man who showed symptoms of the disease was quarantined in Frankfurt on Saturday after being taken off a New York to Singapore flight. So far, the illness known as severe acute respiratory syndrome has killed 9 people and infected more than 150. Most of the countries affected are Asian, including China, Indonesia, the Philippines, Singapore, Thailand, and Vietnam, as well as Canada and now Germany.
The concern is that, number 1, we don't know exactly what the organism is. Number 2, we don't know what the incubation period is.
In Asia, health workers are taking precautions in treating patients. And while no cases have been identified in the U.S., the Singapore doctor reportedly visited a New York hospital last week. And a woman who had been on a business trip to Atlanta is now hospitalized in Canada.
You have to have intimate contact because all the people who were infected had intimate contact with the people who originally had these cases.
The CDC is analyzing samples to try and determine whether the disease is a virus or bacteria, but says it does not appear to be bioterrorism. Still, U.S. officials are advising travelers to postpone non-essential trips to any of the affected countries. Gretchen Carlson, CBS News, New York.